All right, here we go. Chest surgery update number 2. Let's go. What's up everyone, Wubo here and welcome back to my channel. Now as promised before, I was going to give you guys some updates on everything that's happening to me regarding this chest surgery that I just had. But I kind of want to give you a little bit of updates on some do's and don'ts. Now before I get into it, there's something I really want to just dip into and just kind of bring it up because we're in the month of October, we're coming to the end, and one of the biggest things you see all over TV, especially with NFL football, is breast cancer awareness in the month of October. Now this is a key thing that you should keep in mind, especially when it comes to male breast cancer. Yes, males can get breast cancer. And gynecomastia, though it is not something that will constantly put you in a position that you will get breast cancer, it is something that you want to be aware of, and especially if you have breasts or anything like that, or especially if it runs in your family. So just like I said in my other videos, you want to make sure you speak to your doctor, make sure that you're checking yourself because it is common in men. Matter of fact, for my surgery, after my tissue was removed, as part of my surgery, it was actually sent off to be screened to see if there's any breast cancer that I may or may not have. So that I found that to be very important and something I talked to my doctor about, which was great. It shows that my doctor was very thorough, and that's something that I was definitely looking for. Now remember, the information in this video is only meant to be informational. It's not intended to be any kind of substitute for any kind of medical professional advice, diagnosis, or treatment. So please make sure that you always consult with your doctor, get as much information as you can, and try to use this as a resource in any of the information that I'm sharing with you. So thank you for being here, and let's get into the topics. The first topic I'm going to share with you is right after surgery, you can't take a shower. Almost can't take a shower for 48 hours. So you're not supposed to shower nor bathe for 48 hours after your surgery. Now, what can you do to help this out is, for me, right before I went into surgery, my surgery was at 7 o'clock in the morning. Around 6 o'clock in the morning, I took my shower. I scrubbed with Hibiclens, which was a disinfectant that was given to me by my doctor, and I made sure that I cleaned thoroughly. I knew I wasn't going to be able to bathe for almost 48 hours. So by doing this, after my surgery, the first 48 hours, I actually didn't stink at all. So that actually helped me out. So don't shower or bathe after surgery, but to kind of offset that, take a shower, bathe right before surgery, and that should help you out post-surgery or anything moving forward. Okay, topic number 2, don't stand up straight or lie flat on a bed, which is really hard to do because you want to lie down in a bed, you want to get some rest, but you want to make sure that you are putting pillows underneath your legs, or that you're sitting in a recliner or something that's a little bit upright. I just had surgery, chest surgery. I also had some abdominoplasty. I just had a whole workaround because I had so much excess skin and what was going on. Now, what I was advised is I was going to be able to stand up straight. I had to walk around and walk flexed at the hips, which is counterintuitive to the surgery itself. But remember, you are healing at this point in time, and you don't want to develop any major scarring or tear anything or cause any pain. So don't lie flat on a bed. What you do want to do is put some pillows underneath your legs, pillows underneath your head, lie down in a recliner, something that allows you to be a little bit flexed at the hip. So while you're healing, you are as comfortable as you possibly can be. The next don't in this category is you don't want to sit down for long periods of time. You just had surgery. There's a lot of things going on with your body and a lot of fluids. You're wearing a compressive vest. It's squeezing you. Fluids have got to go somewhere, and you want to make sure that that is circulating in your body as much as possible. Now, what I was advised when I actually had my surgery was that right after surgery, a lot of fluids are going to flow distally. So you're going to see some swelling in your legs, possibly in your calves and your thighs, maybe in your groin area. So one of the things you do want to do is try to stand up and walk, a little bit here and there hourly. Try to stay mobile. What I did is not only did I walk, I also have some compression socks. These are things you can get at CVS, you can get at Walmart, or you can probably go to your local doctor and see if they could recommend a store for you to purchase these things. You can probably find them on Amazon. You just want to make sure you get the right compression level, which that is a whole other topic in itself. But compression socks will help, staying mobile will help, walking will help. You don't want to sit for long periods of time, and you want to make sure that you are getting up and you're staying active, because that is the best path to your recovery. All right, well, this next one is one that was a little scary at first. Is because I just had the surgery. It's been 48 hours and I was able to take my shower for the first time. And I had to remove this vest and all this compression. And what you don't want to do is remove all of this compression while you're standing. So do sit down, remove your vest, let your body kind of get used to less of that compression before you stand up. You could get lightheaded, you could fall. There's so many complications that could possibly happen where you just want to make sure you're being careful. So make sure that when you are clear to take that first shower, or you are clear to take off your vest or any of your compression, that you are sitting down, you remove it, and you are safe. So do sit down, be careful, don't stand up and remove your vest and cause any kind of lightheadedness or issues, which could cause some kind of fainting or falling. And the last thing I want to advise you is you don't want to scratch anything. When your body is healing, you go through itches you probably haven't felt in a long time, and you want to probably scratch and relieve that itch because you just had surgery. Come on, man. Be smart about it. Sometimes the vest can get a little itchy directly against your skin. And what helps is sometimes you can wear a shirt right underneath it. You can put some padding and gauze over your sites and put a shirt over it and then put your vest over that. That has helped me relieve some of that pressure against my skin, some of that scratchy feeling. But oh man, do I want to scratch so bad. So don't scratch, don't rub. Do your best to try to make sure you're healing and your skin is feeling good. Put a shirt on, so do wear a shirt. Do wear something between your skin and the vest, and that helps you out as well. Well, that's it, guys. That's what I wanted to share with you, some of the do's and don'ts of some of the things that I'm experiencing right after surgery. Now, I had my surgery approximately a week ago, so tomorrow, again, I'm going to have my first post-op follow-up appointment, so I'm looking forward to that. So far, I'm kind of liking the results, but I'm looking a little bit, bruised up, and I got to see how well I heal moving forward. So I'm looking forward to my appointment tomorrow. I feel more mobile, I feel moving, I feel good. So I'm looking forward to having this appointment and seeing how this goes. Now, if you found this video to be helpful or informative, please share again or hit that like button right below. If you are new to my channel, please hit that subscribe button and that notification bell. That helps support this channel and allows me to keep bringing this information to you. Now, as I said before, this is something that I just kind of want to share with you guys and just kind of let you know what I experienced. So I hope that this is information that if you are considering surgery like this is something you can use for yourself. So I do hope you find this helpful. Thank you so much for watching, and I'll see you guys in the next update.